I'm Dr. Wilson Triggs, plastic and reconstructive surgeon here in sunny Miami, Florida. I'm originally from Huntsville, Alabama. I did my training at the University of South Florida in Tampa, Florida. I went to medical school in Lahiri Medical College. I specialize in aesthetic breast surgery and aesthetic body contour. I would say the best part of being a plastic surgeon here in Miami is that people know what they want. I think in other places they may not have a good idea. And here in Miami, people either want their breast bigger or their butt bigger. So it's like one or the other. And I also think that as a plastic surgeon down here, you're almost like a mini celebrity at the same time too, which has its pros and its cons at the same time. I would say I know my most requested procedure is a Brazilian butt lift or, lipo suction to the torso with fat grafting to the buttocks and the hips. I would say probably I'm most known for what most patients come to me for or I'm recognized about are probably mommy makeovers, which are tummy tucks with breast lift with implants and liposuction. That's kind of where I think I have more notoriety, but I do mostly BBLs. So my advice for a man in this space where it's mostly 95 to 98% women dominated or as a collective is that one, always use a chaperone, always give your best behavior, be very professional at all times. There may be times where you feel like you can joke around or be a little bit less professional, but I would strongly discourage that. I think it's also good to document everything if there documentation needs to be had. But at the end of the day, be professional, always use a chaperone, and if you don't deviate from that, then your character will precede yourself, and so you'll always have the benefit of the doubt. Oh, absolutely. Yeah, I mean, I live in Miami. I see it all the time. So if you have a certain aesthetic, you're going to get more perks, especially in a beauty-dominated society down here or culture. So yeah, it's definitely a real thing. I know multiple women, have multiple friends that they definitely use the pretty privilege. I think for men it's mostly the money privilege. If you look like money, they'll throw something, or somebody. If I have a friend that's well connected that we hang out, and he just throws a name around and we're in. So I don't know if it's a pretty privilege for me. Outside of when I get hotels, I have noticed that sometimes I get upgraded. But I think it works for men too. I would say some of the pros of being in the aesthetic community is number one is the lifestyle for sure. You build your schedule how you want it. Of course, the money is a lot better. You're not dealing with insurance programs and things like that. It has its cons too, but I'll say lifestyle number one. And if you think it financially goes along with that as well. So the difference between a plastic surgeon and a cosmetic surgeon is cosmetic surgeon can be from any medical specialty, pediatrics, OB-GYN. I've seen family medicine, and they'll do some 1 year or 6 months residency or fellowship and only doing cosmetic procedures. A plastic surgeon is someone that has done a full residency in plastic surgery, meaning we've done reconstructive, cosmetic, burn, microsurgery, all lumped into one. And so our training is a lot more rigorous. It's a harder standard to bear, and that our specialty is truly in surgery and not like family medicine or some non-surgical specialty. So aesthetic surgery in high BMI patients, any person with a high BMI, and you keep in mind, BMI is not an absolute standard or number. There's some fluctuations. People with high BMI don't necessarily mean that they're fat or anything like that. So it's more of a judgment call, but the literature shows us that higher the BMI, higher the risk of complications. And that's not just with aesthetic surgery, that's with any type of surgery. So the lower you can lower your BMI, the better result you can have, and sometimes even less complications you have. So for me, my BMI cutoff is 37 for a single procedure. And even with 37, you could still have complications, and that's still on the higher side of the BMI scale. So one, you got to look at the whole patient for the picture, and then just know that in our documentation that the higher the BMI, the higher the risk of complication. And that's with any surgery for, not necessarily cosmetics. So my thoughts on TV shows related to plastic surgery. Botched is a good one, actually. Those are two board certified plastic surgeons, well known. One of them has written multiple journal articles and papers. They're legit. I think there's other shows which, shine like a negative light, or not necessarily negative, but gives like a unreal expectations, like Nip Tuck. It started off kind of like standard plastic surgery and it got like really outrageous. So it really just depends. But I think like if you look at the credentials of the people that are being featured on the show, that kind of gives you the best idea. And those shows are the ones that feel like give us a more favorable light of what we do. So do I listen to music in the OR? Absolutely. I remember in training, only had one attending that didn't allow us to listen to music when we were in the operating room, but all the attendants listen to music. For me personally, I listen to a lot of trap music in the OR. If it's a longer case, then it's R&B. And then towards the end of the case, like probably the last 30 minutes or so, when we're kind of like doing the superficial stitches and putting on the dressings, I'll put on pop music because it's just like a high intensity, more rapid. And so we're like putting the stitches in and putting on the dressings on as quick as possible. It's just like real bubbly type of feeling. But yeah, those are my musical preferences in the OR. So yeah, I would say, man, I listen to a lot of Jeezy and a lot of Future in the OR for sure. So my favorite sneakers in the OR. So originally, if you followed me from the beginning, I wore nothing but low top red Chuck Taylors throughout residency, throughout med school. When I started my clinicals, it was kind of like my trademark. Even when I started operating down here in Miami, definitely while I was in Ohio before I moved to Miami, that was my trademark. And then I just started like wearing like Jordan 1 sneakers. But the Jordan 1s aren't as comfortable. And so recently I just been wearing like all blackies. And sometimes I'll just switch it up to like, if it's shorter cases or shorter OR day, I'll wear whatever. But for the most part, I wear like all black Yeezys in the OR. And I'm thinking about taking it back to the original Chuck Taylors again, since that was such a signature thing for me. But we'll see. I might wait till next year and rebrand or rebrand from the shoe standpoint. So there's a lot of allegations about plastic surgery and rappers and rap beefs. So yeah, I mean, there are telltale signs for like liposuction, would be the scars, how the belly button looks, actually how the actual lipo looks. If you see someone that's gaining weight, but they seem like they still have a six-pack, then, that's another telltale sign because all the fat's been removed from the sub-Q space. And now they're gaining visceral fat, so they look fat, but they have abs. So there's a couple of ways to kind of like identify if someone's had work done, because there's no such thing as scarless plastic surgery. But yeah, it's a thing now. I've heard like rumors of other rappers and stuff like that, other than what's going on in the beef, that have had work done and they keep the most secretive. Because with men, it's still pretty taboo for plastic surgery. For women, it's not. Like, people will shout out their surgeon all the time. They usually don't care. So yeah, that's my tidbit about it. No, man, I'm working on that. Well, I mean, I have a record that a patient of mine did. She's still underground out of Kentucky. Shout out to Keith Savage and Dada. She wrote the record, and then I remember I was marking her up for surgery, and she was like, "Hey, I wrote this song. Will you check it out?" I was like, "Oh, bet. Like, just send it to me." I didn't think she was going to send it to me. And then literally the next day, she DM'd me the song, and I brought Amber here, my lead coordinator, to listen to it. I said, "This is kind of a bop." And I let a lot of my friends listen to it, because I was just like, you don't want to be biased about it. And they'll say, "No, this is dope." And so I let my social media team listen to it. And they were like, "Oh, we should shoot a video." And we shot a whole full music video on it. It's dope. But I would say that's probably the only song that I know of, saying no mainstream artists, just mostly underground. Because I've had another patient that was a rapper, and she shot me out, but nobody mainstream yet. So when I performed plastic surgery on a small person, absolutely, as long as they were healthy, they were compliant patients, and their medical doctor clears them, I have no problem in sitting down, discussing their expectations, and seeing if I can meet them and, optimize whatever beauty they already have. So yeah, absolutely. I think making sure that, keeping everything proportional, if they're not really trying to look for a more dramatic look and keeping it more on the natural side, that probably would be the hardest part from the standpoint. Yeah, for sure. this first picture I really like. I think they did a really good job on the lipo, like with his torso, like bringing it in. As for like the actual abdominal itching, it's okay. I think maybe if they, I don't know exactly what they use because there's different types of lipo. Maybe if they would have used like laser or J plasma to help with some of the skin typing, it would have like really like accentuated his abdominal muscles, kind of give him more of a six pack look. And then it also would have had the skin contract more, so the skin wouldn't look as loose. But from the actual silhouette, like the lipo, it looks good. Like you can see his chest is more defined, it's very small. You know what? I think they should do whatever makes them comfortable. Because I know I'm a private individual. Some people just don't want that information out there. I feel like, should they lie about it? Oh, I don't know. I think it's really just on no. Whatever makes them feel comfortable. Also wouldn't, like, if they do say they had work, I don't see no problem with them shouting out whoever did the work though. That would be a problem to me. Like, Dr. X, Y, and Z did this, tell the masses and, tell them you had work done, shout that doctor out.